are on the board of ICCMO.
ICCMO.
Tell me a little bit about your background and training with this.
My background is obviously I've been around for a while. So I've been around long enough to have personally known L.D. Pankey, trained under L.D. Pankey, personally. He along with Henry Tanner. I trained under Pete Dawson. I got to know Pete Dawson extremely well. We even were in business together at one point in time. I also had my teeth done, not this one's, but another round by Dr. John Coyce. I've taken all of his courses. I think Dr. John Coyce probably gives you the best all-around continuing education program that there is. Okay. I now have had my eyes opened to the orthopedic relationship of the lower jaw to the upper jaw. That's why ICCMO stands for the International College of Craniomandibular Orthopedics. And now I do things a different way. Before, I would have patients that I would refer out for head pain. Mm-hmm. I refer nobody out. I have all of the specialists in my area referring to me. I have the dentist referring to me. So now I'm treating cases that I could have never, ever, ever treated before. And I tried. I mean, this goes back to 1978. So I started doing this new type of dentistry. Some people call it neuromuscular. That has its bad connotations, but it's also physiological dentistry where the body's seeking balance and we help the patient find the balance that they need.
You've seen results in your practice?
We've seen, Rainey, I have seen outstanding results. And I've got testimonials, and I know a lot of dentists don't like testimonials, but if you're like me, if you work day to day and you have these patients that are in pain and you're able to get them out of pain, they are so excited and so elated, and it makes you feel great. What makes me feel the best, if you were my patient and you came into me and you had a headache and I had the time to interview you and I had the time to examine the muscles and your bite, and to be able to say, Randy, I am 90% sure, no question about it, that I can help you. Now that makes me feel good. And I would have never been able to do it doing the dentistry that I did before. And when I say dentistry, I'm talking about when I tried to help people with head pain. I'm not talking about bread and butter dentistry. Bread and butter dentistry, I do it exactly the same as I've always done it. John Coyce, there's nobody better than him to go see about that.
But has this kind of revamped your career? I mean, kind of giving you that oomph.
Well, I'm 72 years old and I don't plan on quitting. It's got me excited again because I know what I can do. I know how I can help people. I know how predictable it is.
So how does somebody get involved in the ICCMO organization?
Oh, you become a member. And with the member, you've got a lot of benefits. And along with that, there's a yearly meeting, and the yearly meeting is fantastic. And you get to meet people that know all the things that you want to know. You can pick up your mentors there, you can get your friends there, and you can just start a new philosophy about how to treat these people in pain. You will learn how to treat people in pain.
Now, your buddies that are dentists have known you for years. Are you calling them and saying, you got to do this?
Well, yes, but my buddies did it to me.
Okay.
That's how I got into it. So yes, I'm doing it to the people that I know, saying you got to get involved. You know, you got to start doing this. And so we're looking for dentists that I would love for other dentists to have CR training like I've had, to be able to have the experience that I'm having right now, at my age, at the end of my trip. And I'm excited, and it's fun. So dentistry is fun for me, and it's because of this.